Hello, everybody. My name is Paul Holden, President, excuse me, President and CEO of the Burnaby Board of Trade. Before we start, I'd like to take a moment to recognise that we are on the traditional homeland of the Hunkaminam and Skohomish-speaking people, and we extend our appreciation for the opportunity to hold a meeting on this territory. So about the event, beginning with step 3 of the provincial government's BC Restart Plan, employers will no longer be required to maintain a COVID-19 safety plan, which I know all of us were working on for quite some while now. And instead we'll be transitioning to a communicable disease prevention plan. In today's session with WorkSafeBC, we're going to be discussing the fundamental components of a communicable disease prevention plan and share information and resources to support employers in developing their plans. Hopefully, when you're armed with this information, you and your businesses can keep operating safely as we move forward. First of all, I'd like to thank our sponsors. So this event is part of a business resilience programming that we offer, which is created by our Centre for Burnaby Business Recovery and Resilience. The Centre, which is a part of the Board of Trade, is your hub for COVID-19 supports and economic development activities to help support the recovery of our economy and our community. The Centre is sponsored by a number of organisations which help make its work possible. And these organisations, who I think are on your screen now, are at the platinum level SFU, Douglas College and BCIT School of Business and Media, at the gold level Electronic Arts and TD Bank Group, and at the silver level Port of Vancouver, Pacific Blue Cross, Fortis BC and Hemlock Printers. And as always, I'd like to thank our annual partners. We have a great group of organisations who really stand out as top corporate citizens here in Burnaby and support our work throughout the year. And you can see their logos, I believe, on the screen as well. So now we're happy to get on with today's session. As we go through the presentation from Chris, if you have any questions, please enter them in the Q&A. And if I can manage juggling the mouse around, I'll make sure that I see those questions, and we'll try to save some minutes at the end to ask and answer some of the ones that you've posted. So today I'm pleased to be joined by Chris Back, who is the Director of OHS Consultation and Education Services at WorkSafeBC. And for many of you, this won't be the first time you've seen Chris. We've had a few sessions with him during the last number of months. OHS Consultation and Education Services serves the workers and employers of BC by positively influencing health and safety behaviours and disability management practices throughout partnerships, consultation and outreach. Chris has been with WorkSafeBC for 6 years in a number of positions, and prior to WorkSafe, he held various leadership positions in health and safety and disability management, particularly in the healthcare sector. So Chris, welcome back. Good to see you again, and I'll turn things over to you.
Yeah, thank you very much, Paul, and thanks everyone for joining in today. You know, it's interesting. We did a lot of webinars through sort of, I'd say, the May, June, July timeframe of last year. Sort of waned off a little and then picked up again in September, October, and then waned off a little, and now it's picking up again as we move into communicable disease prevention. So, so what I'm going to do here is I'll just quickly share my screen. And I'm going to run through probably about 25 minutes worth of some slides here, and then we can open it up for Q&A afterwards. And really the focus for today is around transitioning from COVID-19 to communicable disease prevention in the workplace. So what I'll cover for you is sort of where we're at, to talk a little bit about the restart plan. Won't spend a lot of time on that, as I think people are fairly familiar with what's been announced through the provincial government and PHO over the last number of weeks. And then really focus in on developing what it means to develop a communicable disease prevention plan, and hopefully reduce some anxiety on what that actually means and how it relates to the COVID plan that you have been required to have in place since May of last year. And then we'll talk about some information and resources available to you, and then open it up for Q&A after that. So where are we at today? As I said, I think many of you, if not all of you, are going to be aware that we are in the midst of the province's 4-step plan to gradually restart. And we're in step 3 of those 4 steps. And for employers, that transition from step 2 to step 3 was a significant change. And that's really why we're getting out there and talking to stakeholders at this point in time, because that change really had an impact on what the requirements were for employers, and we'll talk a little bit more about that as we get into the following slides. So as each of these steps progress, it is a gradual loosening of restrictions and protocols. And of course, you can learn more about this at the link that is provided on the slide there, BC Restart. But what I wanted to focus in on, and again, I'm obviously coming into this presentation from the context of the workplace and workplace health and safety. So I'm not going to necessarily delve into the public or community situation as much. I'm going to focus in here on how this applies to the workplace. And there was actually a letter that was issued by Dr. Henry on the 17th of June, which just prior to the start of step 3, which spoke about the transition to communicable disease prevention, and a few key points here that that I'd like to bring up. The first is that, as I've already said, the COVID-19 safety plans that were required since May of last year are no longer required at the beginning of step 3, which took place on July 1st, and that we are able to now transition from those COVID safety plans into communicable disease prevention. Now, it really is a loosening of restrictions, a loosening of protocols. And in my 20-year career in health and safety, this might be the first time that we've ever been going out to employers and workers and saying that you can actually remove some of the health and safety protocols that you've had in place. This is a very unique situation, but that really what this is about, is a loosening of those restrictions of the protocols that you've had to have within your COVID-19 safety plan, and moving to a more generic approach of communicable disease prevention, which really should have been in the past, and maybe not a priority, but should have been a part of a good health and safety management system, which, or at least a good health and safety program, which employers are required to have in place. But the piece that I think is also important within this letter, and I do recommend that you go take a look at it, it's only 2 pages long, but Dr. Henry also makes a statement that employers should attempt to maintain existing COVID-19 protocols where they don't negatively interfere with business operations. And she's referring more so during this transition period of step 3. And that transition could be longer or shorter depending on the type of workplace that you operate, and the type of environment that you might work in, the type of exposures that you and your staff might have, the comfort level of your staff, and we'll talk about that a little bit as we get into the informational resources piece towards the end. But there's still some fear and anxiety out there around how fast maybe the transition is now happening, the potential risk that people might still feel around COVID-19. And so part of this last point here around maintaining existing protocols is really to help to respect that everyone is moving through this at their own pace, and to encourage employers to maintain those protocols where it doesn't negatively interfere with business operations. But in the end, it is your decision as an employer on which protocols you are going to keep in place, outside of those that I'll talk about in a few minutes, which will be required under communicable disease prevention, which you would have already had in place as part of your COVID-19 plan. I'll also just point out that WorkSafeBC is not coming out and arbitrating which protocols you should be keeping and which protocols you shouldn't be keeping as an employer. That again is going to be up to you as an employer, whether, examples that Dr. Henry has used as barriers, maybe keeping some of the physical barriers in place, maybe keeping the directional signage. If you're a grocery store, for example, a directional signage that would lead people up and down the aisles. If those don't negatively impact your business, then it is recommended that they stay at this point in time. So what is communicable disease prevention? How does that differ from your COVID-19 safety plan? And for those that were utilizing the WorkSafeBC template and resources that we had for COVID-19 safety plans, you'll recall that we had a 6-step process that we were encouraging. And what we've tried to do here in transitioning to more of a global approach to communicable disease prevention is we've tried to mimic those same steps. Now we have reduced it to 4. We've simplified this a little bit for employers, and I'll sort of explain why as we go through this. But the intent is to try and keep it as close to the COVID-19 safety plan as you had those 6 steps that you had gone through for developing that plan, where the biggest difference is in step 2 and what those measures are and those protocols are that you would need to have in place. So step 1, and I'll walk through this here. So step 1 is really around understanding the risk. And you'll recall that step one of the COVID-19 safety plan was assessing the risk. So it's essentially the same. Within this piece, though, it's not so much around understanding the risk within or assessing the risk within your own workplace, because essentially the risk is considered to be very low right now, which is why we are able to transition from COVID-19 safety plans to communicable disease prevention. So it's not around assessing the risk within your own workplace. It's around understanding the risk from a PHO, a provincial health officer and medical health officer perspective. So as we move through this transition, particularly as we probably get into the fall and what would typically be your flu season in normal years, we are going to have to watch where there might be local outbreaks, there might be regional outbreaks, there might be outbreaks within specific workplaces. And it's going to be important for you as an employer to stay tuned into that information and understand where those outbreaks might be occurring around the province and follow any guidance, any orders, guidance, or notices that would be coming out from the medical health officers or the provincial health office. So understanding the risk is really about monitoring what's happening at the regional level and the provincial level and following any direction that's provided at that point in time. Step two is around implementing the measures. And you'll recall in the COVID-19 safety plan, our step two was also around implementing the control measures. But the control measures now look very different. And I'm gonna sort of show two slides here, and then I'm gonna jump back to this one. So you'll see in the orange text there's a component around ongoing measures, those measures that you as the employer need to maintain at all times. And then just jumping ahead for a moment, there's additional measures that may need to be implemented as a result of any local or regional outbreaks that occur in any direction provided by the PHO and the MHO. So I'll come back to this slide in a moment. So let's talk about the ongoing measures. And really those ongoing measures come into 5 points, if I can put it that way. And you would have already had all of these 5 points, or at least the first 4 points in place in your COVID-19 safety plan. So this shouldn't be anything new or over and above what you've already been doing over the last 15 months or so. And the first is around policies, and that's policies to support staff who may be demonstrating any symptoms of a communicable disease, such as those that we're very familiar with in COVID-19, and supporting them to stay at home when they have any of those symptoms and not to come into the workplace. So that is the first requirement, if I can put it that way, that employers need to have in place under communicable disease prevention. And that applies not just to COVID-19, but to any communicable disease. The second is providing hand hygiene facilities, and providing the hand hygiene facilities and the supplies to ensure that workers have the ability to wash their hands regularly, and that you're encouraging them to be washing their hands regularly. Now, this was all the part around having the facilities available, that's already within our regulation. That existed prior to COVID, that all employers were obligated to ensure that their workers had the ability to have hygiene facilities available to them during their shift, during their work time. So that was already in existence. And really what we've done here is we've just focused in on ensuring that the supplies and the hand hygiene facilities are available, so people can wash their hands or sanitize their hands throughout the day. And the third being around maintaining a clean environment. Now, this during COVID-19, there was actually specific guidance that came out from the BC CDC, which may have differed depending on the industry, but it did provide some guidance around how frequent that cleaning needed to be. BC CDC has now moved away from that guidance and instead is more so along the lines of maintaining a clean environment that you as the employer need to determine how frequent that is going to be. So you need to look at the type of workplace that you're in, the type of environment you're in. Are you inside? Are you outside? What sorts of exposures? Is there a lot of public coming into the workplace during the day? So you need to consider all of those factors. And then just the piece here is around maintaining a clean environment. So you can decide whether or not that's going to be a once a day cleaning. Maybe in some cases you might want to do a twice a day cleaning. That's up to you. But the piece here is the importance of maintaining a clean environment. The fourth point is around ensuring building ventilation is adequate and properly maintained based on the manufacturer's instructions, so that it's functioning as it was designed to function. Now, this mostly applies to indoor settings for the most part. And this also was an obligation and already a requirement in the Act and the regulation prior to COVID. That if you have building ventilation systems in place, you as the employer need to ensure that those systems are properly maintained and operating as intended. So nothing new there. And then the fifth point is not so much towards having policies in place to ensure that your workers are vaccinated, because there's other issues, there's privacy issues around that. We can talk a little bit more about that a bit later. This is more so around supporting employees in receiving vaccinations. So A, that you're encouraging them to become vaccinated, B, that you're ensuring that they have the time off to become vaccinated, or supporting them as needed there. And it's really around you demonstrating as the employer the importance of becoming vaccinated for any vaccine related illness. So yes, right now we're talking about COVID and the encouragement of everyone in this province to become vaccinated for COVID, but this can apply to any communicable disease where a vaccine is available, and that you are also encouraging your staff to become vaccinated from that perspective. So this is around support and encouragement, not around having policies in place or mandating vaccinations. And, you know, actually, maybe I'll just touch on that now, because this is a question that has come up in every session that we have done so far around whether or not employers can have policies in place to mandate vaccination. And all I would say at this point in time, because that's really outside of WorkSafeBC's mandate at this point in time, that unless if there was a provincial direction from the provincial health office making it mandatory, that's not something that we would ever require under the Act and the regulation. Now, some employers may decide to go down this road, and that is up to them as the employer, but we just encourage that you do get legal advice on that if you are going to consider policies around mandatory vaccinations, that it is a balance between health and safety, privacy, human rights, and other labor laws that are out there. So it really, I encourage you to do your due diligence and seek advice on that if you are considering going down that road. So that's an overview of the ongoing measures that are expected to be maintained at all times. Now, if there is an outbreak at the local level, regional level, wherever, there may be a need to implement controls based on the direction from public health or the medical health officer. And that likely would look very similar to what you've had in the COVID-19 safety plans in the past. So maybe looking at physical distancing, putting barriers back up, possibly having mandatory masks again in an indoor space, enhancing the cleaning, disinfecting. And for many workplaces where you do have worker transportation that's offered, or even worker accommodation, there might be modified transportation or accommodation practices that would have to be put in place. So those would be really instituting some of the protocols that have already been used through COVID-19. Step 3 is kind of a combination of what step 3 and 4 were within the COVID-19 safety plans, about having the policies in place and ensuring that those policies are communicated, that your workers understand the protocols that you have in place, and that they've been trained on any protocols that might, around cleaning and disinfecting, for example, and that you have the appropriate supervision, and that your supervisors are knowledgeable and that they're providing the appropriate supervision. And then the last point there, just around providing information to workers in a language that they understand. And I've sort of already spoken to the italicized text at the bottom there around privacy and confidentiality in how you're putting those policies together. Step 4 mimics what step 5 was within COVID-19, and that's around monitoring that plan, do, check, act approach, continuing to get input from your workers, seeing what's working, what's not working, and modifying your plan as you go forward. Now, I do want to emphasize, as I've emphasized in prior sessions, the importance of involving your workers in this process. As I mentioned at the beginning, there's still fear. There are still folks that might think this is going too fast in terms of a restart. They have fear coming back into the workplace. Maybe they have underlying health conditions. Maybe they're caring for an elderly parent. Whatever the case may be, everyone is going at their own pace. And by involving your workers and communicating with your workers, it goes a long ways to allaying that fear. Now, again, there's already obligations under the Act and the regulation to have joint committees in place. or have worker health and safety representatives if you're a small employer. So including that structure, involving your workers in this process is more important now than it ever has been. And I can't emphasize this enough, that you want to ensure that you are having those conversations with workers as you're developing your plan. And then, of course, once that plan has been developed, that you ensure all of your workers are aware of it, as I mentioned in step 3. So a couple more minutes here just on some information and resources available to you. You can go to our webpage if you haven't already. We have a specific page that is set up on the step 3 of BC's restart that speaks to pretty much everything I've gone through today. We have a template on there that you can download that gives you information. It's a guide to developing your communicable disease prevention plan. Now, as I mentioned at the beginning, there is no requirement to have this plan documented. Officers won't be coming out and asking to see your written plan. You don't have to post your plan like you did with COVID-19, but you do need to ensure that you are following the practices that were outlined in those ongoing measures. Now, we've heard from a lot of employers that it would be helpful for them to be able to document their plan, and therefore we have modified the guide to include a fillable PDF template at the end of it, where you could document it there and use that as part of your overall health and safety program, or use it as a communication tool for your staff. So that is available to you on the website. We also have lots of other resources on there that speak to many of the same resources during COVID-19. We're just starting to strip out the words COVID-19 and replace that with communicable disease prevention. It speaks to ventilation, air circulation, hand washing. We have posters for occupancy limits if you want to maintain some of that. Posters around encouraging how to properly cover your mouth and nose during coughs and sneezes, how to use a mask. All of that's still available on our website, just in a more genericized form on that page. We've also developed a guideline that falls under our structure. If you're familiar with our structure, we have the Workers' Compensation Act. We then have the Occupational Health and Safety Regulation. And then within the regulation, we have applicable policies and guidelines that help employers understand what their obligations are. So we have developed a guideline under Section 21 of the Act, which is the General Duties Clause for employers, that speak to a lot of what I've gone through already and what your requirements are as an employer within those 4 steps of communicable disease prevention. And I can't get through this presentation without also mentioning that the importance of continuing to also focus on the other health and safety risks within your workplace. Communicable disease prevention, COVID-19 is just one aspect of an effective occupational and safety management program. So ensure that you are focusing in on the other risks within the workplace that may lead to serious injury, disease, or death. So some common issues and questions. We're still hearing a lot about this. We've seen it throughout COVID-19. And I think we're still in a situation where, as I said, everyone's moving differently throughout this. Some people, as I've said, might still be a bit fearful and feel that the province is moving too fast in the restart. But then there's also others that are, can't wait. And they, as of July 1st, they're basically not doing anything anymore. They're not wearing their masks. You've seen these folks out there. There was even people during COVID-19 who were already in that mindset. And it has led to some situations, particularly in those publicly facing organizations like restaurants, hotels, retail establishments, where there's been conflict. And if you are in one of those situations where there is a possibility of conflict, you need to ensure that you have the appropriate violence prevention programs in place, and that your workers have gone through the appropriate training to deal with those situations. Now, again, this was a requirement prior to COVID. For any situation where violence may occur within a work site, that was already the employer's obligation to ensure you had a program and that workers were trained. But it's important that we bring this up now. We have lots of resources on our website that can help with that if you're looking for anything. Mental health, I've talked about the fear and the anxiety of returning to the workplace. We've got some resources here that were specific to COVID. They're still applicable at this point in time. We've developed a guide for employers as well as a guide for workers. There's also lots of external organizations, some of them linked on this page here, which you can have access to after the presentation. And I do encourage all employers to be focusing as much on psychological health as they are on the physical health of their workers. And then lastly, in this section, just around working from home, there are many employers we've heard from that are going to continue allowing their workers to work from home. So this is just a reminder that if you do have workers working from home, as the employer, you still have a responsibility for their health and safety. And it's important that you have a working at home policy in place that covers hazard and risk assessment, proper ergonomic setup of computer workstations, ensuring that your workers have emergency evacuation procedures in place, education and training is provided, check-in procedures, so on and so forth. Now, there's obviously privacy issues around you as the employer going out to a worker's home and doing that hazard and ID and risk assessment. So we have created some resources that sort of checklist type format that you can offer to your workers. They can go through that, and then you can maybe have a phone call with them or a Zoom meeting to be able to go through and do your due diligence as an employer. We also, in that first link on this page, we also have a great resource for setting up a computer workstation. And really, that is probably the biggest risk for your workers working from home. Outside of those emergency situations, it is about the ergonomics. If your workers are sitting on a bar stool at the kitchen counter, leaning over a laptop for 8 hours a day, if that goes on for too long, then that is a significant risk for potential musculoskeletal injuries. So I do encourage that you're working with your workers to consider the ergonomics of how they're setting up their station in the home environment. And that first link is a great resource that is very easy for you and your workers to be able to work through in how to make your computer workstation fit you. So some of the other frequently asked questions that we're getting, I've addressed most of these already, but just to run through them. The first one, do communicable disease plans need to be written, documented, or posted? No, they don't, but we do have a template available for you if you would like to have it documented. The second one, can employers maintain COVID-19 protocols if they choose to? Absolutely. You can continue with your COVID safety plan as long as you like. And at this point in time, as I mentioned earlier, Dr. Henry is even encouraging keeping those protocols in place where it doesn't negatively impact your business. Will masks be required? So no, masks are no longer required. They are recommended for anyone over the age of 12 who is not yet fully vaccinated, recommended in public spaces and in retail where you're not fully vaccinated. And full vaccination means 14 days after your second dose. So just to give you some context there on what that's referring to. Are there industry-specific protocols for communicable disease? No, we've tried to get away from the industry-specific protocols. We had 32 different industry pages on our website that we have taken down that provided protocols for COVID-19, because we do feel that we can transition now to more generic protocols, which I talked about a number of slides ago. So we don't have those industry-specific pages available anymore, but we do have a lot of the genericized resources that are available to you as you're considering what your plan is going to look like. And where can employers get more information about ventilation and airflow? We definitely have some information on our website, so we've got resources available for you there, as I recognize that is probably going to be one of the biggest questions as we continue to go forward, is what the employer's obligations are around maintaining their ventilation systems, as that might be sort of out of scope for a number of employers that just kind of go into their indoor office environment or indoor working environment and just assume that the system is running properly. But you would want to ensure that you understand your obligations as an employer related to ventilation and airflow. Now, if you do have any questions, beyond today's session, if you have any questions, I do encourage you to contact us through our prevention information line. Our officers are not out there inspecting specifically on on communicable disease prevention, and there's no longer a requirement for COVID-19 safety plans. So we're not out there with a specific inspectional initiative in this area. We are doing our regular inspections, and as a part of those inspections, we are asking questions to see if employers understand this transition. If they have any challenges, we're taking a very consultative approach to that. So we're not going out with any sort of heavy hand at this point in time. My team is also out there doing consultations with industry to ensure that industry associations, which are a great resource for you, also have understanding there. But if you do have questions, I encourage that you give us a call. We've got our Lower Mainland number and our toll-free number on the slide here, and we are answering the call within 30 seconds at this point in time and offering full response on an average within an average of an hour after receiving the query. So that brings me to the end. I've got 2 email addresses here. I've got mine. You're more than welcome to email me after the session today. I can guarantee that my response rate is probably not going to be 30 seconds. But if it's about what I've talked about today and how I might be able to offer more assistance, please feel free to email me. You can also email our general inbox at consultationservices@worksafebc.com. But if your question is specific about your communicable disease prevention plan and how that works within your workplace setting, I do encourage you to give us a call on a prevention information line, as that will be your quickest response. And in a lot of cases, we are referring to that group if it is very specific to your working environment. So with that, Paul, I will stop sharing and we can open it up for any questions that folks might have.
Thanks a lot, Chris. Excellent, great information there. We've got to remember, everybody, please post any questions you might have. We've got a couple of questions that are coming through. I just had a couple that had come to us beforehand. So just sort of going back to something you walked us through in terms of the working from home, assuming there's nothing to do with communicable disease prevention that employers need to worry about for employees working from home, but it's really just that ergonomic and environmental setup, and understanding what you can and can't do to force something on someone in their home.
Yeah, thanks, Paul. So yeah, to clarify, the assumption really, and I think it's a fair assumption to be made, is if you are working in the home environment, then you don't have exposure, if I can put it that way, exposure to transmission through the general public that you might have in a workplace setting, or your coworkers. And the assumption there is that your family, who is within that home environment with you, you are contained within that bubble already. So the communicable disease protocols that I talked about don't really apply to the home environment necessarily. But if you had, for example, a situation where your workers are working from home, but they're going out and visiting clients or traveling throughout the day and seeing other people, then you would need to consider how those communicable disease protocols would apply to that environment. But if your workers are working in the home environment and they're there pretty much 100% of the time for the purposes of their tasks, their job tasks, then the communicable disease piece really doesn't necessarily apply so much. It is about the ergonomics and the emergency procedures, and ensuring that your workers are set up appropriately in the home environment, particularly if it is going to be ongoing in perpetuity, that you would want to ensure that they're set up. And I think the important point there is, if, for example, there was a situation where your worker did sustain an injury that was, for example, ergonomic related because they didn't have the appropriate workstation set up at home, you would, if it's an acceptable claim, you would still be on the hook for that as the employer. So that still comes back to your performance as an employer in that home environment. So it is something to consider as you're looking at what your policies around working at home are going to look like going forward.
Yeah, that's interesting. We've had a number of questions from people wondering just how far that goes, and if somebody's, I don't know, set up a book on a bookshelf and the book falls off and lands on them, those kind of situations. I mean, just how far does it have to go? Is there a resource online people can go to find out a few more specifics?
Yeah, I mean, we do have actually a claims section under our COVID-19 pages that speaks to the claims process related to COVID-19. Now, this isn't necessarily a COVID-19 question because it's around working in the home, but the same tests would apply. Essentially, the home becomes the workplace. So the same tests would apply. There would have to be proof, essentially, that the worker injured themselves in the course of doing their duties in their work environment, which would be their home environment, or at least, the section of their home where they do have their computer workstation set up. But it does have to still be in the course of their duties. So our claims team, if a claim was submitted, our claims team would still go through their typical process of assessing all of the merits, all of the information within that claim, and determining whether or not it's an acceptable claim. If you, as the employer, you also have rights to appeal that claim. So if the claim was accepted and you are questioning whether or not it actually did occur within the scope of the duties assigned to that worker, then as the employer, you can put in an appeal, and you can go through that appeal process, which starts with review division through WorkSafeBC. And if it goes past review division, it actually goes to the WCAT, which is the Workers' Compensation Appeal Tribunal, which is a separate entity to WorkSafeBC, to be able, for employers or workers, to be able to utilize that system to potentially appeal a claim and the decision made.
Thanks a lot, Chris. I'm just going to sort of go back and forth with some of the questions that have come in through the Q&A. Is it a requirement to make non-employees coming into the office space, such as clients or other visitors, do we need to make them aware of our communicable disease prevention plan or process? And in what way would we have to make them aware of it?
So there's no obligation to do that from a provincial health order or WorkSafeBC perspective. So you will recall during COVID-19, there was actually an order in place that stated that the COVID-19 plan had to be posted and that everyone that comes into the worksite had to have access to that. That order has been rescinded. It is no longer in place. And there's nothing within the Workers' Compensation Act or within the Communicable Disease Prevention Guide that we've provided that would state that workers or employers need to post that plan. Now, that's up to you as the employer on whether or not you could provide, if I can put it this way, provide comfort to your clientele or comfort to the public that you are still monitoring the situation, that you do still have appropriate practices in place. So that might be a good business decision for you, but there is no obligation from a workplace health and safety perspective to have that plan posted.
Okay, thanks, Chris. I think I might know the answer to this one, but do we need to continue with daily health checks?
Good question. Actually, that is something we've added to we have a frequently asked questions section on our website that we're updating daily, and I encourage you folks to take a look at it. That's actually a question we just updated based on feedback we were receiving. No, there is no longer a requirement for the mandatory daily health checks. Now, I do want to qualify that, though, that first point under the ongoing measures of communicable disease prevention was ensuring that as an employer, you have policies in place to support workers staying from home if they have any staying at home if they have any symptoms of communicable disease. So really, for that to occur, your workers would still need to do that self-check on a daily basis or on a regular basis. And if they do have symptoms, that they are not coming into work and that you're supporting them to stay at home. But that whole idea of a mandatory health check and employers ensuring that their workers have done that on a daily basis, that is no longer required.
Okay, thanks. And what about another question? What about the 2-meter table distancing at restaurants or other restaurant-based distance requirements?
There is still, I would actually encourage you, and to be honest, I haven't read it in the last week because I think it was just updated. There is still an order in place for foods establishments. So if you just go onto Google and type in PHO orders, it'll take you to the Provincial Health Office orders page, and you can pull that order up and have a look at it. I don't believe that requirement is still in place, but there are still some requirements in place, such as I believe the number of people at a particular table and the requirement to not get up from your table and intermingle with other tables while in a restaurant. But I don't believe the 2-meter requirement between tables is still in existence, but I don't quote me on that. I would encourage that you go take a look at that order. If you own a restaurant or a food services establishment, just take a look just to confirm.
Yeah, thanks. Talking masks for a moment, because I think this is going to be, as we transition, a fairly contentious area. You're already seeing in some stores, I was in a store the other day and it's gone up to probably almost half the people are not wearing masks as they walk around at the moment. What tools does a business have to say, I'm sorry, I know the requirement has changed, but we still want to mandate mask wearing in our business?
Yeah, it's a good question, and outside of the mandatory vaccination question, this is probably the second most frequent topic of conversation that we've been weighing in on, and it sort of comes back to the comments I was also making around a violence prevention program being in place. And so I think for an employer to make that decision, depending on the business that you have in place, you need to weigh all of those factors. You'll want to consider the safety of your staff, or maybe I shouldn't say the safety of your staff. You're going to want to consider the current mental health and general sense of your staff on their comfort level of mask wearing. So if you have a lot of staff who still really want masks to be worn, then you may want to consider having the policies in place. You'll obviously have to think about what whether you're going to make it a mandatory policy or a recommendation at this point in time. And as an employer, if you are going to go down that road, because it is no longer a requirement and it's no longer mandated, which that order for public spaces and retail establishments that the PHO had in place, that was sort of the employer's backup, so to speak, to be able to say, look, this is an obligation, so you need to wear those masks. That no longer exists. It's only a recommendation. So an employer will need to make those decisions based on many factors on whether or not they decide to have a mandatory mask policy in place. But if you do decide to have that policy in place, for whatever reasons you've chosen, then you need to consider how you as the employer are going to respond to a situation where the general public comes in, someone comes in, says, there's no longer a requirement, I'm not going to wear the mask, I'm not going to follow your policy. And that's where you might run into the conflict. Yeah. So in terms of resources for the employer, that to me is the biggest thing that the employer needs to consider, is how are they going to respond in that situation? Do they have a violence prevention program in place, and have their workers been trained appropriately to handle that situation? Yeah, no, that's a good point. And within an office environment, I think I'm right in saying that the rules are, again, it's not mandated, but they're I guess recommended. But staff, are there still distancing requirements in terms of where staff can sit in relation to each other? No. So again, those distancing requirements are no longer in place. If it doesn't impact business operations, that you are still encouraged to utilize the space as best as you can. If I can sort of use some of the terminology that the BCCDC and PHO have been saying, is use all your space. Don't crowd people into one area of your office building if you can spread them out. But there is no longer a requirement for the physical distancing within the workplace. And the other, you sort of bring up a good point, which brings me back to your last question around masks, is, if you're in an office setting and you don't have exposure to the general public, so that whole violence situation really isn't a part of your considerations as an employer, but you have, say 10 office staff within your building, you might want to have a conversation with your staff and say, what's the general consensus of the group around wearing masks? And if you decide as a group that you would all like to maintain a mandated mask policy, there's nothing wrong with that. I mean, that's over and above what's required. So you're more than welcome to do that. And on the flip side, if you decide that you're not going to have that mandatory mask policy in place, I would encourage you as an employer to still support those staff who want to wear a mask, and that you are encouraging your staff to say, we recognize and respect the fact that everyone's going through this at their own pace and in their own way. So if you would still like to wear a mask, even though we don't have that policy in place, then please be assured that we are going to support you in that, and more than happy if you want to continue to do that going forward. Yeah. And just again, just as last question, if we may, just on the subject of the staff engagement, you mentioned during your presentation about if you're a small organization, you can have a member of your team on a working committee of some sort. I think I heard you mention. Can you just explain how that works? Yeah. So again, this was a requirement under the Act and Regulation, and has been for many years. That if you are an employer of 20 or more workers, then you are required to have a joint occupational health and safety committee, and that joint occupational health and safety committee has representation of the employer and representation of the workers. And it's very clearly laid out in the Act. There's requirements to meet on at least a monthly basis. There's requirements for training. There's requirements to address health and safety issues. So it's all laid out very clearly. And the encouragement of involving that process, involving that structure to be able to work through communicable disease prevention. If you have fewer than 20 workers, and so between 10 and 20 workers, then you are required to have a worker health and safety representative. So you don't have to have a committee, but you do have to have one worker representative that the employer would speak with around occupational health and safety. If you have fewer than 10, then you're not required to have that worker health and safety representative or a joint committee, but you are required to still involve your workers in health and safety. And how you choose to do that as an employer is up to you. So you have a little bit more flexibility if you're a really small employer, and more structure as you grow as an employer. Great. Thanks a lot, Chris. Great information there today. And look forward to having you back again. And hopefully when we do have you back in the future, we're looking at
continuing to have more positive conversations about moving forward in a healthy workspace. But thanks a lot. You've been a great resource for us over the last number of months, and we've really appreciated you taking the time to share that information with our members.
Yeah, absolutely, Paul. If I can just close just a couple comments there. Absolutely, be happy to come back at any time. I'd actually probably even be happier to come back and talk about other health and safety issues if that's of interest to your membership as we transition through communicable disease prevention, and as we transition even into step 4 and beyond, and really come out of this pandemic situation. Let's get back to talking about those health and safety issues that can lead to serious injury, disease, and death in the workplace. And I think this is a great forum to be able to talk about those things, and we look forward to that opportunity in the future. So thanks for having me today. I really appreciate it.
That's a pleasure.